It's a pleasure to have the possibility to talk about xenotransplantation with Emanuele Cozzi. So, Emanuele, can you give us a kind of overview of what has been developed in the last, I would say, 5 years in the field of xenotransplantation? And if you go, please, a little bit into the detail of what is the genetic manipulation behind this recent clinical achievement.
Yes, I mean, for sure, the big breakthrough is really the level of techniques that have been developed in the genetic engineering field, that has been applied, of course, to this genetically engineered pig. So I would say that substantially we are aware that 10 genetic manipulation have been introduced in the pigs that have been used in the current clinical trial of orthotopic cardiac xenotransplantation at the University of Maryland. These 10 modification regard, first of all, the deletion of the sugar that we were aware were the major antigen recognized when doing xenotransplantation into man, and these are of course, the alpha-gal, the NOI5GC, and also the LBT4. And also another important thing is that we have added to these organs the genes that code for inhibitors of the complement cascade activation, CD55 and CD46. On top of that, we have to take into account the physiology. A pig is a pig, a man is a man, and there are also not only immunological incompatibilities, but also physiological incompatibilities. And these regard essentially 2 points. The first one, coagulation. So we have now genetically engineered pigs who have express human protein that somehow modulate the activation of the complement cascade. And then we have deleted a gene that regards the growth factor hormone receptor, and in so doing, we transplant an organ and we are sure it will not grow during the post-transplantation phase. On top of that, we are aware that there are other genetic engineering that has been introduced, other gene for HO1 and also for CD47. In addition to the big step ahead on the genetic engineering side, we have now acquired a tremendous knowledge on a new inhibitor of the immune system activation. And we are talking about here interfering in the activation pathway based on the CD40, CD154 ligand pathway. And in this specific case, what the FDA has authorized is xenotransplantation of the best pig organ with what we consider is the best immunosuppression in the combination pig to human or non-human primate xenotransplantation.
Can you go a little bit in greater detail about these preclinical models in pigs? Who is doing it? Which are the groups that are taking care of this kind of experimental enterprise, and which are the developments in these days?
Yeah, so if we speak about the groups dealing with cardiac transplantation, so that means to transplant a life-supporting heart into a baboon or into, usually into a baboon. I mean, the two leading groups are at the University of Maryland in the United States, in Baltimore, and certainly there is a first-class group also in Europe. In particular, at the University of Munich, there is a very successful program of orthotopic heart xenotransplantation into baboons with survival that exceeds 7 or 8 months. As far as kidney, then we have a larger number of groups, and certainly very important the contribution here of also of the University of Alabama with survival of bilaterally nephrectomized primates receiving a pig kidney. Survival exceed 1 year.
Which is again great. But let's go a little bit into the clinical setting now. We had a fantastic example in these days. Can you comment about safety? We usually think about zoonosis risk and others. Can you develop on that?
Yes, so certainly safety aspects and also ethical aspects are critical to make sure that indeed we propose something which is viable for a clinical application. As far as safety, we have a better understanding of the possible risk associated with xenotransplantation. No transplant is 100% safe. Even in allotransplantation from man to man, we can transmit disease. As far as the current understanding in patients who have received pig organs or pig tissues, like for instance, patients who have received porcine skin as a consequence of serious burn, we know that none of these severely burned patients who were exposed to pig skin graft were somehow infected. And the major concern here is for PERV, porcine endogenous retrovirus. But in none of the studies undertaken to date, there is evidence that you can transmit zoonosis from pigs, of course, pig that have been grown in particular so-called specific pathogen-free places where they are bred and where the organs are taken.
Clearly, we are pretty far from a wide diffusion of the adoption of xeno. But how do you see the next developments in the clinical setting? And if you see possible to develop also clinical experiences in other transplant settings, like kidney, for example, at the moment, or you think we will wait better evidences from the heart transplantation setting?
Remember here that we are aware of 4 clinical trials or clinical applications that are underway currently in the United States. One is at the University of the Massachusetts General Hospital, and there we know in Boston that they are authorized by the FDA to undertake a clinical trial with pig skin into severely burned patients. So one study. Then there is the well-known study of cardiac orthotopic transplantation that is underway at the University of Maryland. And then there are 2 studies, and these regard kidney xenotransplantation, and these are a study that is underway at the NYU, New York University, and another study at the University of Alabama. So that means that currently there are 4 trials or 4 studies that are authorized in the United States. They deal with 3 different xenografts: skin, heart, and kidney. Of course, we have to move forward a step at a time, looking into the details of the results of what we are trying to achieve together. So having said so, clearly we are at the very beginning of our clinical application. We are now fortunate that for the first time we can study into man what has been studied extensively in the last 10 years or even longer into non-human primate studies. And the preliminary results we are aware of are extremely encouraging. So basically, the results achieved with the first clinical trials in kidney xenotransplantation or in heart xenotransplantation or in skin are extremely encouraging.
Clearly, it is very early to say, but this genetic manipulation is massive in a way. And so we are looking to sustainability as well. Do you think that the costs in the future will be sustainable and the cost effectiveness of the procedure will be reasonable in a way and positive in a way?
If we are able really to demonstrate that the proof of concepts are successful, what we had seen in non-human primate is indeed something that we achieve into man. So we will arrive at a stage where from preliminary clinical trials, we will broaden the application of these technologies. The cost. I mean, clearly, if we consider the cost of a patient who is kept alive on dialysis, okay, and you have that funding available to replace it with an organ, and in such a way that the patient does not require any longer to go to dialysis, clearly you have a budget that can be spent, in my view, in a much more constructive manner, where basically the patient is no longer a patient that is a cost to society, but potentially the patient becomes himself or herself an added value to society, and the costs that are in a way somehow spared from dialysis can be invested into this new technology, in my view, in a constructive and successful manner.
Emanuele, you are also a member of the ethical committee in the context of the International Xenotransplantation Society. So, which are the ethical issue, the major ethical issue that you see in this particular area of development?
Well, at this stage, clearly we want to make sure that all the ethical standards are met. So first of all, we are seeing clinical trials that are undertaken in a country where there are very strong regulatory and ethical processes. So that makes us to be confident that we are dealing with the highest standards. We want to make sure that when xenotransplantation will be available, it will be available indeed to everybody with the principle of equity that doesn't take into account other factors that should not be taken into consideration when dealing with the health of patients. And clearly, we want to make sure that if we propose this on a broader scale, the safety principles are met. If we are not sure that we can, in addition to efficacy, also provide safety to our patient, clearly we will have to stop and put on hold whatever we are trying to achieve. And in said so, today, the technology that we have to genetically engineer animals is a way that could, for instance, enable us to delete sequences of viruses or other damaging sequences that may be in the genome of a pig we are not as yet aware of.
Thank you very much, Emanuele. Thank you.
Thank you.